Fibula is a cylindrical leg bone. It found next to the tibia on lateral side. Tibia is the medial bone of leg, whereas the fibula is the lateral bone of leg. Fibula and tibia run parallel to each other in leg and are similar in length, but fibula is much thinner than tibia. The thicker tibia has a much greater function in weight bearing than fibula. Definitely, weight bearing bone of the leg is the tibia. Learning objectives. At the end of this lesson, students should be able to identify the bone and its site determination, mark the attachment of muscles and ligaments on fibula, elaborate the joints formed by the fibula, describe the nerve injuries related to it. Now remember, in today's class, we will not discuss muscle attachment and nerve injuries plus quizzes, but only we will be discussing osteology of fibula. In my next lecture, I will discuss the muscle attachments, nerve injuries plus quizzes. Identify fibula. This is fibula, that is the lateral and smaller bone of the leg as compared to the tibia. Tibia is a medial and thicker bone. It is thin as compared to tibia. Tibia is much thicker. It is homologous of ulna of upper lip. Now in diagram on the left side you can see the tibia is the lateral bone of the leg. On the right side you can see the comparison with the tibia. The fibula is comparatively much thinner. So main weight bearing function is of tibia from the leg to the foot. Identify fibula. As like other long bone, the fibula also possesses upper end, shaft and lower end. So this is the fibula, which is comprises of three parts. Upper end or head of the fibula. This is the head of the fibula or upper end of the fibula. The superior surface. This is the superior surface of fibula, which bears a circular articular facet. Now as you can see, this is the circular articulating facet on the superior surface of fibula, and it is a lateral for the lateral condyle of tibia. So this articular facet will articulate with the lateral condyle of tibia. Now this is the lateral condyle, this is the upper part of fibula, tibia, and this is the fibula, and this is the superior tibiofibular joint or proximal tibiofibular joint. So superior surface bears circular articulating facet which articulates with the lateral condyle of tibia. The apex or head or styloid process projects upward. As you can see, from the superior surface there are upward projection, apex like projection. This is called as a styloid process of fibula. So projects upward from it posterior laterally. This is important to remember. This lies posterior laterally. As you can see in this diagram, it looks like a anterior laterally. So if we'll turn the bone slightly on this side, then it will be superior laterally. As you can see in diagram on the left side, this is the styloid process. This one. So this is superior posterior laterally. If it would have been here, then it will be anterior laterally, and it is slightly posterior and lateral. So posterior laterally. What are the important things in the upper end or head of the fibula? There is a circular articulating facet which articulates with the lateral condyle of tibia to form proximal tibiofibular joint. And other important point, the conical projection or apex of the head of the fibula is called as a styloid process, which give attachment to the ligaments. Now it is situated posterior laterally, and then there is an other slope like area just anterior to the this articulating facet. This also give attachment to the muscle. We will discuss in a while. Upper end or head. It construction immediately below the head. This is head, and this is narrow construction immediately below the head is called as a neck of fibula. Lower end or the lateral malleolus. Now you can see this is the lateral malleolus. This is the medial malleolus. Medial malleolus is formed by the lower end on the medial side downward projections of tibia, which forms the medial malleolus, whereas the lateral malleolus is formed by the downward projection of the lower end of the fibula. So this is medial malleolus, downward projection of the lower end on medial side of tibia. This is the downward projection of the fibula. So this is this part which is subcutaneous, and you can feel it, and even it's visible too. And so this lateral malleolus is comparatively to the medial malleolus is 0.5 centimeter lower. As you can see, if I draw a line from here till here, the medial malleolus is coming at this line, but the lateral malleolus slightly downward, and this is slightly upward. So what is the difference? This is the 0.5 centimeter lower than the medial malleolus. Now anterior surface is 1.5 centimeter posterior to that of the medial malleolus. Now as you can see in this diagram on the right side, medial malleolus is comparatively toward the anterior side, and this is towards the backward or posterior side. On this diagram you can see this is the medial malleolus is towards the anterior side, whereas the posterior lateral malleolus is towards the posterior side or heel side. This is towards the toe side, right? So it is a 1.5 centimeter posterior to that of the medial malleolus. Lower end or lateral malleolus, the anterior surface. First we will discuss, I will let you know, the lower end or lateral malleolus possesses four surfaces. Number 1 anterior, number 2 posterior, lateral and medial. Now you can see this is the anterior surface, behind will be the posterior surface, towards this joint will be the medial surface, and this exposed subcutaneously is the lateral surface. In this diagram, this is the anterior surface, this is lateral surface, this side is the medial surface, and behind will be the posterior surface. So anterior surface is a rough and rounded. As you can see, this is the rounded and rough. This is the anterior surface of the lateral malleolus or lower end of the fibula. Medial surface bears two important features. This is the medial surface, this part. This is the medial surface which possesses two important parts. One is the articulating facet, other is the fossa. So anteriorly, this is the medial surface. Anteriorly, it possesses the triangular articulating facet. As you can see, this is the triangular articulating facet which face anteriorly, and this is the malleolar fossa posteriorly. In this diagram, this is the triangular articulating facet which is articulating with the talus, that is the tarsal bone, and to form the ankle joint, where this downward and posteriorly, this is the malleolar fossa. So medial surface possesses two important features. Anteriorly, there is a triangular articulating facet, and posteriorly there is a malleolar fossa. The anterior triangular articulating facet articulate with the talus to form ankle joint, whereas the malleolar fossa is posteriorly. Lateral surface of the lower end or lateral malleolus is subcutaneous. If you palpate your own lateral malleolus, you can feel this lateral surface. Let me take laser. Yeah, you will feel this lateral surface. So this is the lateral surface which is subcutaneous, means in between skin and this lateral surface there is no muscular tissue. It is subcutaneous. You can palpate it, you can feel it. So lateral surface is subcutaneous. The posterior surface is marked by a groove. This is the posterior surface. This hole is the posterior surface, which is marked by a groove for the tendon of the fibularis longus and fibularis brevis muscle, or peroneus longus or peroneus tertius, or brevis muscle. So this groove for the muscle of the lateral compartment, and this groove possesses the lateral margin and medial margin. This is the groove. It is the lateral margin and medial margin. Side determination. Now this is important. 2 points are important for the side determination. Number one, you are not holding bone upside down. Number two, you are holding the right on the correct side and left on the left side. Means you are not holding the right on the left, left on the right, and you are not holding it upside down. Means this you are holding downward, this upper end, and lower end you are holding it like superiorly. So these are the two important features you have to remember in the side determination. The upper end or head is slightly expanded in all directions. As you can see, this is the upper end or head, which is slightly expanded in all directions, right? All directions. So this is the upper end, right? You will not hold it down, so you have to see. And number 2 point, on the upper end there is a upward projection apex that is called as a styloid process. So this is another point to identify the upper end. Now the lower end or the lateral malleolus, this is the lower end or lateral malleolus. Here you can see this is the anterior surface, and again anterior surface, this is more closer view. Malleolar fossa, triangular articulating facet. Above these is the triangular roughened surface, which we will discuss later, I told you before. So this is facing anteriorly, this will face posteriorly, right? Now lower end or lateral malleolus is expanded anterior posteriorly and is flattened from side to side. Now you can see this is the anterior and this is the posterior. So it is expanded anterior posteriorly, it much thicker anterior posteriorly, and from side to side, from anterior and lateral side, medial and lateral side, this is flattened backward before, and from anterior posteriorly it is expanded. So that is important. Okay, upper end is expanded in all directions, whereas the lower end is expanded anterior posteriorly, whereas from side to side or before backward it is flattened. Side determination. Now previous 2 points, like styloid process, upper end is expanded in all direction, lower end is expanded anterior posteriorly and flattened from side to side. These both points for the to hold the bone not upside down, right? To hold bone correctly means you are holding the upper end upward and lower end downward. Now this point is you have to identify whether it is right bone or left bone. So this is quite tricky to understand, but I am sure you will understand. Medial side of the lower end bears the triangular articulating facet anteriorly, we already know that. Malleolar fossa posteriorly. Now this is the medial surface, this is the triangular articulating facet for the ankle joint, for the talus. So it should face anteriorly, means this is the anterior side, behind will be the posterior side. So articulating facet is facing anteriorly, where the malleolar fossa will face posteriorly. This is the upper end, which is expanded in all directions, and there is a styloid process. These are the identical for the upper end, where the lower end is expanded anterior posteriorly, right? Anterior posteriorly it is, and flattened from side to side, from medial and lateral side. This is the medial surface, this is the triangular articulating facet, and this is the malleolar fossa. So malleolar fossa should face posteriorly and articulating facet should face anteriorly, right? So this is the medial bone. Now suppose if I am holding this bone on my left hand and I'll fix my thumb into the malleolar fossa, and this articulating triangular facet is facing posteriorly, right? Now this is the malleolar fossa, I am holding and malleolar fossa, and this is facing posteriorly, means okay, this is wrong. If I hold it in my right hand, now this articulating facet is facing anteriorly and malleolar fossa is posteriorly, so means I am holding it correct. So this bone is the right bone. So if you hold the bone in your right hand and you fix your right thumb within the malleolar fossa, right, malleolar fossa, and if this articulating facet is facing anteriorly and malleolar fossa remains posteriorly, means I am holding this bone right, means I am holding it in my right hand, so this is my right bone. Suppose if I hold this my left hand and I'd keep my thumb over here, but this articulating facet will face posteriorly, backward. That means I'm not holding it correct. If this would have been a left bone, then malleolar fossa would have been here and articulating facet would have been here. Then if I'll hold the malleolar fossa, the articulating facet would have been face anteriorly. That means that is the left bone. So this is the point of identification. Okay, you are not holding it upside down and you are not holding it or left. You should know. Shaft. Shaft shows considerable variations. As you can see, these surfaces are quite like twisted and all. So this because it is molded by muscle attachment on it. It has 3 borders and 3 surfaces. The borders are anterior, posterior and anterosseous or medial border, right? Now this is the anterior border, this one, and this is the posterior border, which is sort of rounded in its upper part and it is more pointed in its lower, or you can more little sharper in its lower half. And here will be the this is anterior, this is posterior, and just medial to the anterior will be the anterosseous or medial border. 3 surfaces, medial, lateral and posterior. From medial to this anterior border on this side will be the medial, lateral to that will be the lateral, and behind will be the posterior surface. We will discuss each and every border and surfaces in detail. One anterior border. Now this is anterior border. If I this is anterior border, starting from the anterior part of the neck of the fibula, and this is all is the anterior border. You have to follow me. This is the anterior border, right? My marker is slightly going here and there, but I hope you will understand, right? This is the anterior border. Now anterior border begins just below the anterior aspect of the head. As you can see, this is the head, this is posterior side, and this is the anterior side. Is beginning from the anterior aspect of the head. At its lower end, it is divided to enclosed and elongated triangular facet. Now you have to just look at this picture. This is the anterior border. Now from here it will split into 2 parts or 2 borders. One is going towards the lateral surface, one is ending at the anterior surface. This is the part which is, so this divide into a triangular. Now you can see this is sort of triangular area. This is an elongated triangular area which like a divide to enclose the lateral malleolus. Now this is the lateral surface of the lower part of the malleolus, or you can say the lateral malleolus. So this is the lateral surface of the lateral malleolus. This is the anterior surface. This one is the anterior surface, and this one is the posterior surface. Now which is continuous with the lateral surface of the lateral malleolus. Is already told you, this is the lateral surface of the lateral malleolus. Now again I repeat, the anterior border begins just below the anterior aspect of the neck, right? It is at its lower end, it is divided into two parts. At its lower end, it divides into the two borders, and it will enclose a triangular surface, elongated triangular surface. As you can see, this is sort of elongated triangular surface, and that covers, or that is continuous with the lateral surface of the lateral malleolus. As you know, this is the lateral malleolus. It has four surfaces: anterior, posterior, this one will be more medial, and this is lateral. So this division of the anterior border will enclose this lateral surface. I hope we are clear. Now here you can see this is the lower end of the anterior border. Here, now from here it splits into two borders. This is the one side and this is the other side. Now this will end at the anterior surface of the lower end, and this will go and cover the lateral posterior part of the lateral surface of the lateral malleolus. Now this hole is the lateral surface. This hole is the lateral surface. This is the anterior surface of the lower end of the malleolus. Again, anterior border starting from the anterior aspect of the upper end, and it will go straight forward and downward. This is the anterior border, and from its lower part it will split and divide into two borders, and one will go laterally and one will end at the anterior aspect of the anterior part of the anterior surface of the lower end of the lateral malleolus. Now this elongated triangular surface enclosing the lateral surface of the lower end of the fibula, or you can say the lateral surface of the lateral malleolus. This is the triangular elongated part of the anterior border. This is lateral surface. This is the middle part of the border. From here it is bifurcating or dividing. Above you can see it is coming from the upward from the anterior aspect of the. Now this is the posterior aspect. This is styloid process. This is the anterior aspect. Now this is the upper part of the anterior border. This is the middle part of the anterior border, right? And this is the lower part of the anterior border. Now in this diagram it will be more clear. Now this is the cut section of the leg. This is anterior compartment of, this is tibia, this is fibula, and this green is the intraosseous membrane, which is connected tissue membrane in between these both, tibia and fibula. Now tibia has the anterior border, medial border and intraosseous border, whereas the fibula has a intraosseous or medial border. This is the anterior border which we were discussing, and this is posterior border, right? Now this is anterior border, this is medial border, and this is the medial crest which is present on the posterior surface. Now in between the intraosseous border and anterior border, this surface will be the medial surface. In between the anterior border and posterior border, this surface will be the lateral surface. In between the posterior border and intraosseous borders, this whole surface will be the posterior surface, which is divided by medial crest. We will discuss it shortly. So we were discussing this anterior border. Now this is the anterior compartment of the leg, this is posterior compartment of the leg, and this is the lateral compartment of the leg. I hope we are clear. Posterior border. This is the posterior border which is in line with the styloid process, or you can say this is starting from the styloid process, and this is sort of rounded. As you can see, this is a rounded border, right, as compared to the anterior border which was sharp in the middle, and even the intraosseous border is comparatively sharper. So this is a rounded border in its upper part, but in its lower part it is comparatively little sharp, and it ends at the posterior surface. This is the lateral surface, this is the this one is the posterior surface, right? So this is the posterior surface of the lateral malleolus, which is marked by a groove. this is the groove, and this is the lateral margin of this groove, and this is the medial margin of this groove, and this hole is the posterior surface of the lateral malleolus. Here you can see this is the anterior surface, which is marked by the malleolar fossa posteriorly and a triangular articulating facet anteriorly this side. And as you can see, this is the anterior aspect, this is the anterior border starting from the anterior aspect of the fibula head, and it come forward downward, and at this level lower end it bifurcate into or split into two parts. Anterior part will end at the anterior surface of the lateral malleolus, whereas the posterior part, which will enclose the lateral surface of the lateral malleolus and ends up in the lateral surface. Now this triangular elongated surface is the lateral surface, which is actually elongation of the lower part of the anterior border. Now this is the posterior border starting from the styloid process. This is sort of rounded in its upper half, and its lower half it's comparatively more like sharper, and it will end at the here. This is the posterior surface, this is the groove, this is the lateral margin of the groove, this is the medial. So it will end at the medial margin of the groove on the back of the lateral malleolus, or you can say the posterior surface of the lower end of the fibula. Now this is the posterior aspect of an initial part. So this is styloid process, starting from the styloid process or in line of the styloid process. This is the upper part of the posterior border, this is the upper part of the anterior border, and we have it is rounded. As you can see, this is sort of rounded, not sharp in its upper part. And then we have its upper end lies in the line of styloid process. This is the upper end which lines with the line of the styloid process. Below border is continuous with the medial margin of groove on the back of the lateral malleolus. This is the back of the lateral malleolus, this is the groove, this is lateral margin, this is medial. So this is the posterior border, lower end of the posterior border, upper end in line of the styloid process. This is the middle part of the posterior border, which is rounded in its upper part and little sharper in its lower part. Now this is posterior border, styloid process, a rounded posterior border. You can see this one is the posterior border, and this is the upper half, and this is its lower half. This is the posterior aspect of the lateral malleolus. This is groove on the posterior aspect. This is the lateral part of the margin of the groove. This is the medial margin of the groove. So it is continuous with the medial margin. It will go upward and more upward, and it will end at the line of styloid process. So this is the posterior border. This is anterior border. Introitious or medial border, it in its upper part, upper 2/3, it lies very close to the anterior border. As you can see, this is the anterior border, this one is the anterior border, and this is the medial border or introitious border. So in its upper 2/3, it is very close to the medial border, so it is maybe indistinguishable. So we will not identify in its upper part, okay, which one is the anterior border, which one is the introitious border. So less than 1 millimeter distance, they are very close to each other, but it goes down, it slightly gets separated from the anterior border. Like here you can see, this is anterior border, just medial to the anterior border, this is the introitious border. Now it will slightly go separately, it goes down. In this part you can see this is the anterior border, and here is the medial border, but it is not visible, and it coming down. Now this is visible medial border, right? Now here you can see this is anterior border, right? This is medial border. This is medial border. Now again upper part of the medial border or introitious border now lie between medial surface, right? Medial surface which lies between anterior and introitious border. This is the anterior border and this is the introitious or medial border. In between these two we have a surface. This is the surface. This one is the medial surface which lies in between anterior and introitious border. In its upper two-third, as we already discussed, the border, both borders are very close. It is very narrow, measuring less than 1 millimeter or even less, right? So in its upper two-third, it's very narrow, less than 1 millimeter or 1 millimeter, and even it is indistinguishable. But in its lower part, it's comparatively broader. Lateral surface lie between anterior and posterior border. This is the anterior border, right? This is splitting anterior border into triangular aspect, and this is styloid process. This rounded border is the posterior border, right? So in between anterior and posterior border, this surface is the lateral surface. This surface, which is twisted backward, slightly backward in its lower part. It is twisted backward in its lower part. So this is the straight, it is coming down, 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 but its lower part it will go slightly backward. So it is twisted in its lower part. Posterior surface, the largest of three, right, is compared to the medial and lateral. Medial is the narrowest, lateral is comparatively broader, but the posterior surface is the largest of three. It lies between introitious and posterior border. Now this is the medial border or introitious border, right? This one. Take a medial border will be lateral to that, and this is the posterior border, and this surface whole is the posterior surface, right? This whole is the posterior surface in its upper two-third. Now these are its upper two-third from here till here. It divided into two parts by a vertical ridge is called medial crest. Now this is the medial crest. You must be thinking this is the posterior surface, why it is another border is present within the middle of this. So this is the vertical crest in its upper two-third. So this divide this whole posterior surface into a lateral depressed or concave surface and a medial flattened surface. This is the median flattened surface, and this is the lateral concave or grooved surface, sort of depressed surface. Now again I repeat, the posterior surface is the largest of three. It lies in between introitious and posterior border. In its upper two-third, it is divided by a medial crest into two parts. The lateral part which is grooved or depressed, whereas the medial part is flattened surface. Now in this diagram, this is the anterior aspect and this is the posterior aspect. This is tibia, which is medial bone. This is the fibula. This is the lateral bone. And here you can see this is the head of the fibula. This is the neck of the fibula. This is shaft of the fibula. This is the lower end of the fibula. This is the medial surface on this side, right? And this is the lateral surface over here, and this is the anterior border, and just medial to the anterior border will be the introitious border. So you hold the bone in your hand and go anti-clockwise, right? You are holding for the anterior border first, right? And then you will turn towards the medial side anti-clockwise, then a medial border will come, and then again you turn to anti-clockwise, then posterior border will come. Then you have to look at the anterior surface in between the anterior and introitious border. Then you have to identify the posterior surface that will be present between the introitious and posterior border, and finally you will come to the lateral surface that lies in between the posterior and anterior border, right? Now this is the anterior border, this one, and posterior border is rounded. This is the posterior aspect. This is the posterior surface which is marked by a vertical crest that is dividing this surface into two parts. And I think that's all. I will show you video now, and in which I will summarize all of the bone, and you will be like bone will be moving and every aspect you can see, so it will be easier because fibula is much tricky to understand. So this is how it will be easier for you to understand the borders and surfaces. Now this is the lower aspect. Now this is the triangular elongated part of the anterior border. This is the upper part of the anterior border, right? This whole is the anterior border, which is going up in the anterior aspect of the neck. Now this is the anterior border, again anterior aspect of the neck. This is anterior border, and medial to that we will go anti-clockwise. Medial to that is the medial border. Now in between the medial or introitious border, this surface is the medial surface. Now anterior border, medial border, and in between these two, this surface is the medial surface, which is narrow in upper part and broader in lower part. Now this is if you turn more anti-clockwise, there is a depressed uh, grooved surface. This whole is the posterior surface. This is the posterior border. This one, yeah, this is the posterior border, and this is again anterior border. This is introitious border, and in between these, this is the medial crest. This one, this is the posterior border. Now this whole is the posterior surface. This is the depressed part, this is the medial crest, and this is the flattened part, and this is the medial surface, medial surface, and this side will be the lateral surface, and this is the introitious border. This is the medial to that is the grooved part. This is the lateral surface in between the anterior and posterior border. So this is the lateral surface, this one, which is slightly twisted backward, right? And this is the whole is the lateral surface. This is the posterior surface, right, which is in between the introitious and posterior border, which is divided by the medial crest in its upper two-third into a lateral grooved part. This is the lateral grooved part, and this is the medial flattened part. So from the introitious border to the posterior border, this whole largest surface is the posterior surface. The anterior medial surface was the narrowest one in between the introitious and medial border, and in between the anterior and posterior border, the lateral side, this that was the lateral surface. I hope it was clear, and in our next video I'll upload shortly that in